there's this other side of the symphony that's happening with estrogen. So what's happening there?
Yeah. So basically, and we stress, cortisol, that could be at any age. And because progesterone is our most susceptible hormone, if you're in your 20s and, for instance, you're in medical school and, you've got stress upon stress upon stress, you're going to end up losing, and especially depending how your adrenals run. Personally, my adrenals have run high my whole life. I'm lucky they haven't basically shut down, but I've had cortisol steal my whole life. And so progesterone, it's not that I had too much estrogen, it's that I didn't have enough progesterone to balance it. What that leads to is estrogen dominance. So estrogen dominance can happen. It just means that there's not enough progesterone to balance the amount of estrogen in the body. So even menopausal women can have estrogen dominance because they've still got more estrogen than they do progesterone. So it's either estrogen too high or progesterone too low. The end result being that the ratio of estrogen to progesterone to estrogen is off. That ratio should be greater than 100. And that is one of the markers we follow when we do our labs. We treat to make sure that we get the progesterone to estrogen ratio above 100. That is why I feel so calm in giving all my patients hormones, not worrying about cancer, because we're balancing it. We know we've got the right amount.
And that's why we call it hormone optimization or hormone balancing.
Right.
Because we need these tunes to be firing off at the same amplitude or whatever you want to call it, right?
Right.
So estrogen and progesterone need to be at a certain ratio to be in balance.
Yes. And that ratio gets upset by stress. And then that ratio gets upset during perimenopause and menopause. So, we talk about menopause all the time and we make it sound like it's this thing that happens and it's the same for everyone. And menopause is a process. And that's why we now have the term perimenopause. So the body will slowly but surely whittle away the hormones, estrogen being preserved always till the last, until it absolutely cannot do as much estrogen as it did before, because it's the most vital of the hormones, it's reproduction. But if the body has to choose between cortisol survival and estrogen, it's going to cortisol, and it's not doing estrogen. Estrogen has over 400 functions in the body.
Oh boy.
Reproduction being one.
Yeah.
So estrogen is critical, and so the body will preserve it as long as it can. So what happens is, anyone with a lot of stress in their body can end up with estrogen dominance. They're going to start, here are the symptoms, because I think this is...
Tell us the symptoms.
When do I need to worry? When do I need to look at things? When do I need to check? So here are the symptoms of estrogen dominance. This is where you're probably losing some progesterone. You're either super stressed in your 20s or 30s, or you've reached about 40 and now you're starting to hit the perimenopause. PMS, heavy periods, painful periods, headaches, low libido, bloating, mood swings, fatigue, anxiety, depression, breast tenderness, and weight gain. This is, I think, there's a lot of women out there that can relate to these, and they're not even close to menopause yet.
And we have the data on this, right? And I know this because on the Nimbus platform, right?
Yeah.
One of the first questions are, what are your symptoms? Why are you here?
Yeah.
And these are typical things that surprisingly I've seen in a age group that I did not expect it in.
Exactly.
Right? Like you said, the 25 to 35 year olds going through this at that point in life is just wild.
It's wild. It's wild. And, the biggest thing is if you want to try to help that person, which mainstream doesn't want to, you really need to do it as naturally as possible. You need to sync it with their cycle. You don't want to overtake anything. You want to restore it naturally. Mm-hmm. But here's the thing. If we just look at hormones, we're missing the root cause. We haven't fixed her. I can give my 25-year-old patient who's in law school a progesterone capsule. But if I haven't looked at her adrenal glands and her cortisol and supported that, I have put a Band-Aid on it. I haven't fixed it.
You're basically, going back to cortisol steal, just fueling in that. Basically, it's like a pot.
Yeah.
And the pot has holes.
Yeah.
You're putting more water into it. Yeah. But the holes keep increasing because you're not plugging up the pot.
Well, so my best analogy, that's a great one. I might have to remember that. So my best analogy when I try to describe to patients is think of each of these hormones in the cascade as it's a waterfall, and it's a cascade of waterfalls. And each of these waterfalls, if one of them gets empty or lower level, it can't go to the next level.
Yeah.
it's depleted. And so now we're that part of the hormone
You're stuck
cycle
in
is
the
stuck.
cascade, right? That's just chemistry in
You
a
need
nutshell.
all the buckets to be full and overflowing for the cascade to cascade.
So this population that we do not expect to have these issues, the issues you just talked about.
Yeah.
What's your advice for them? Where should they start?
Yeah. So, like we just said prior to that, when you asked me about doing women's hormones, I said, I will do hormones. I will check hormones, but I have to check, besides the big three, I have to check DHEA because it's an intermediary that helps buffer some estrogen and testosterone from stress. It's also great for the body, anti-immune, anti-aging, healthy weight. So it's got a lot of other important functions too. But it's part of the hormones. So if I'm going to look at hormones, I also need to look at DHEA. It's a supplement, not prescribed, but most of my patients, any kind of stress, DHEA is important. And I need to look at cortisol because it's running the show. So if I don't check your cortisol, I definitely haven't gone to root cause. I haven't, and then I need to check your thyroid because fatigue is such a common symptom for women. And your thyroid is your engine of your body. Your adrenals are your spark plugs. Your adrenals are also running hormones. If I just look at hormones, I am truly not going to root cause and I'm going to Band-Aid and I'm not going to fix you. So that is why our panel consists of those. Yeah. And because we can go to root cause.
And that's what you would suggest is a good starting point for somebody who is observing or having these symptoms you just talked about.
Yes.
Start with the test kit.
Exactly.
Especially like a saliva test kit because you can get cortisol levels from it and so on.
Right. And that's why our test kit, we go between 7 and 9. I told you that's when cortisol does our big cup of coffee.
Yeah.
So in that big sort of burst, I can see, are you just barely blipping? Are you bursting through the roof?
Yeah.
Or are you in my nice green realm?
Yeah. And we're using your experience. You can see how much of adrenal fatigue you're actually in based off those bursts, right?
Yeah.
That's where that clinical
Or are you
knowledge...
staying high adrenals all the time and, totally blocking your thyroid, leading yourself to some thyroid failure.